Well, we've been here before. Record-breaking numbers, crowded hospitals, and people in critical need. Medical professionals here in Columbus are asking folks to stay clear of the emergency room if their cases are not severe.
And that's because, as our Stephanie Poole explains, the heavy foot traffic is slowing the response to patient care. Stephanie joins us in the studio with more on that story tonight. Stephanie.
That's right. Hundreds are visiting local healthcare facilities to get tested for coronavirus. But if you're going to the hospital, now that testing may actually take longer. Doctors tell me there's an overflow almost every hour. Up to 250 people. It's the number of patients coming inside the emergency room at Baptist Memorial Hospital Golden Triangle per day.
Every day we've been up 30 to 40% in our volumes for over a week.
The impact of the Omicron variant is leaving healthcare facilities across the country slammed with sick patients. Emergency room physician Dr. Keith McCoy says, before you drive to the hospital, there's one thing you should know.
Our ER is about 30% above its capacity with a lot of volume because of the COVID surge. If they can find resources at one of the local urgent care or the regular doctor's office to potentially get tested, there are other ways that they can do that, then the emergency room might not be the right place for them.
The average waiting time in the ER is around 25 minutes, but that response is slowing down as more foot traffic comes in. On Wednesday, Baptist posted this statement on their Facebook page. The highlighted portion reads, quote, emergency departments are experiencing record numbers of patients presenting with COVID, which is resulting in significantly longer wait times for all patients, including those with emergency needs, end quote. During the fifth wave of COVID-19, Baptist urges COVID-stricken patients to come to the emergency room only if they're experiencing severe symptoms.
If they feel like their symptoms are more serious, or if they have shortness of breath or a symptom that concerns them, or they have a lot of underlying health problems, we certainly don't mind and would want them evaluated, be that the ER or their regular doctor's office.
We treat them as fast as we can. We give them all we can by doing x-rays, doing CAT scans on them, and then they have infusion techniques that we do, give them extra medicine to kind of counteract this disease.
As numbers continue to rise, McCoy asked the public to consider all their resources.
It would take some of the strain that we're currently experiencing in the emergency room that would help us be more efficient with the more critical patients that we have.
Also tells me the Baptist Golden Triangle hasn't experienced an issue providing beds for critical care patients at this time. And for more information on COVID testing centers and resources, you can go to our website at WCBI.com.